So good morning, everybody. I'm Dr. Lisa Larkin, and today is a big day. So this is the first day that I am doing a Facebook Live from the Ms.Medicine platform. And so many of you, if you're watching and you followed me on the Lisa Larkin MD platform from my practice, where I've been doing the COVID updates every day, this is really the first time that I'm doing anything from the Ms.Medicine platform. And for those of you who don't know anything about Ms.Medicine, I thought I'd just say a brief few words before we got into the what's really the Facebook Live is all about. So Ms.Medicine is an organization that I founded, a company that I founded about 15 months ago, which is committed to raising the standard of care of gender-specific women's primary care. And that's, kind of the last 10 years of my career. This is my passion and my mission. And so Ms.Medicine is the vehicle through which I hope to do that. One of the platforms of doing that involves networking women's health trained primary care providers across the US. And that's where Dr. Laurie Birkholz comes in today. So she is my newest Ms.Medicine affiliated partner. She's going to be opening her independent women's health primary care practice in Holland, Michigan very soon. I'm really thrilled to have her as part of our Ms.Medicine family and our team. She brings incredible expertise in a whole bunch of areas to our organization. And I'm thrilled to also say that she's one of our associate medical directors now for Ms.Medicine and is really helping us in all kinds of ways with advancing our mission, specifically in terms of education. Our educational platform, which some of you may have seen, is something that I'm calling Ms.Med Ed. So thrilled to have Dr. Birkholz with us. Thrilled to be doing the first Facebook Live on our Ms.Medicine platform, and hope to have this as a platform going forward to do more educational events, particularly now that we've been so limited by the COVID crisis. So, Dr. Birkholz, welcome. Thank you for joining us today. Thank you for being part of Ms.Medicine. And I'll turn it over to you.
Just as you did that, my phone went off, right?
Yeah, right.
Which is just one of the many challenges that we're all facing with this new norm while working from home. And so I think for me, it's been really interesting as I've transitioned out of the practice that I've been in here in the Holland, Michigan area, and working to create my Ms.Medicine practice. That in and of itself has been a big change, but paired with all of the changes around COVID, it's definitely been very interesting. But I think I can certainly understand where many patients and community members are coming from as they try to figure out, how do I cope with this new normal? How do I cope with all of the uncertainties and the unknowns? I believe that no matter who you are or where you are, those are questions and concerns. I imagine you'd say the same, Lisa, and have heard similar things.
For sure. Sure. You want to talk a little bit about your practice, or you want to talk a little bit about the conversations you've been having with patients now about health and wellness during COVID, or you run with it?
Yeah, no, I'd love to just quickly share a little bit about my practice. My practice location has really been intended to be in Holland, Michigan, and ultimately will be, but I'm excited to share with my current patients and community members that as I've said it, when life throws you lemons, right, you make lemonade. And so my build out of my new space was pushed back a little bit. And I decided I needed to have an alternative, a backup plan in place. And so I'm excited to say that rather than needing to wait until June or later to begin seeing patients, I am in a temporary space in Douglas, Michigan. And so, although I don't have an exact date yet that I'll be able to start scheduling patients, it is looking like it should hopefully be no later than the end of this month. Hopefully sooner, But as I've said before, via social media outlets, patients should just stay tuned. But we're doing the best we can to really be available, recognizing that for so many people, there are questions and there's a need for care. And it's been a challenge to find that. And we really want to be that resource for our patients here in the community.
Well, great. You want to talk a little bit about health and wellness during this time? I see we have a ton of questions, so I don't know if you want to say a few words before we take questions or just jump into questions.
Yeah, anybody who's followed me on social media knows that I am all about self-care, and there's no better time than now to really focus on the basics of health. And so really just coming back to what we all know about how we take care of ourselves. All of those things are going to boost our immunity and hopefully keep us healthy through this pandemic. And so we could talk a little bit about, specifics. So what is it that exercise does for us that may improve our immunity and our overall health? As I like to say, I don't think there's a downside to exercise. And so from the standpoint of, what are the benefits? Why does it make sense to get outside or, turn on a YouTube exercise video, even if it's just for a half hour every day? And there, I think we know that there's good evidence around the impact that exercise has on reducing our stress hormones. And again, I think we can all admit that those are running high for just about all of us. But what we might not know is that as those stress hormones remain elevated over time, it really can impact our body's immunity and our ability to fight off illness. And so exercise helps us to lower those stress hormones, and in doing so improves our immunity and ability to stay healthy.
And you have any thoughts about diet and what we all should be doing right now, right? I think we've seen the data that alcohol sales have increased, right? So I don't know if you want to talk about that at all.
Yeah, absolutely. I think here too, really the evidence suggests that a healthy diet, one that is what we refer to as plant-based, meaning that the majority of our intake is coming in the form of fruits and vegetables and other healthy grains, really, again, holds true in this setting, in this situation. As far as what we should avoid, I think definitely watching our intake of things like alcohol. Now, that doesn't mean you can't enjoy a nice happy hour with your friends this evening, which includes a glass of wine. But, it's easy at the end of a stressful day when we're all stuck inside to open up a bottle of wine or two. And what we know is really the effects on our overall well-being are not good, not just immunity, but certainly our mental health and our ability to deal with the anxiety. Although it may seem to help in the short term, long-term effects certainly aren't there. And so finding a healthier outlet for those end of the day tensions definitely is encouraged.
Right. And I certainly know you're a great exerciser in that way, and your diet's really good. Tell everyone about sleep, what your feelings are about sleep, and you're a big sleep advocate as well.
Yeah, absolutely. Anybody who's seen me knows that one of the first things I ask about is sleep. How much do you sleep? How do you sleep? Tell me about the quality of your sleep. And here, really the recommendations would hold true, which is that for the average adult, really optimal sleep is going to be 7 to 9 hours. Sweet spot for most people is about 8 hours of sleep. But here too, in order to function at our best physically and mentally, we need to be getting that sleep. And so having a good routine, and I will say that this is a trick. My husband and I have been trying to figure out what's the best course for our children to maintain, because it's so easy, especially now with the days getting longer. It's easy to sort of fall into this where you're staying up later, you're sleeping in more in the morning. But what we know is maintaining a consistent routine. So a stable bedtime, a stable wake time is really, really important when it comes to having good, healthy sleep patterns. Avoidance of too much alcohol. Again, it might help you fall asleep, but anybody who's experienced it knows that you're going to be waking up somewhere in the early hours, challenged to fall back asleep. Avoidance of caffeine. That's another one. I've seen a really funny meme of it looks like a race, and it's the coffee cup handing the baton off to the wine glass. But and although funny, and again, I can respect where that's coming from. When we want to think about what's going to be best for sleep, that's probably not it.
Right. I would hate to admit that meme with doing telemedicine from home some now really fits me, actually, right? So the coffee pot is here, and I can actually have a cup of coffee next to my telemedicine. So I'm drinking far more coffee than I probably should right now. Well, great. Well, again, just huge shout out to Dr. Birkholz. We're so excited to have her as part of the Ms.Medicine family now, and really excited for her practice to launch really soon. So Dr. Birkholz, can you see the questions that I can see? I don't actually know that. Can you?
I can.
Okay.
Yeah. Great. So there's a question, is there anything one can do to boost their immunity and, in an effort to try to prevent getting sick? And kind of touched upon that with the things we've already talked about, but unfortunately, there's really no one supplement that's going to do the trick. And I've seen a lot of information out there about, should I be taking zinc? Should I be taking vitamin C? What else can I do? What's the magic bullet? And unfortunately, I just don't think there's anything that you're going to find in supplement form that compares to the healthy habits that we just focused on. So really, daily exercise of at least 30 minutes, a healthy plant-based diet. If you're looking for more specifics, I usually tell patients just Google Mediterranean diet recipes, and you'll get plenty of good suggestions. We talked about sleep. Maybe I didn't specifically state, but I think the other is really just that concept of stress management. So when we get super stressed out, our body releases certain hormones or chemicals, namely cortisol and adrenaline. And although those are very helpful for that fight or flight response in the short term, when that stress goes on and those hormone levels stay elevated, we know that there are very detrimental effects to our health. And so I think if you haven't already in the past developed those coping strategies for stress, no better time than now. And so I have, and again, I'll just tell you my experience is I'm just not around my kids all day, right? Working with my kids, and right, we're all juggling 8, 9 different balls in the air at any given time. And I found for myself personally, just taking the space of 1 to 2 minutes and doing some deep breathing has been enormously helpful. I can almost feel my heart rate come down. I can feel some of that stress go away. So I think that's a really easy strategy. Set a timer once every hour, just stop for 1 to 2 minutes and do some good deep breathing. Lisa, do you have any other suggestions on?
No, you and I speak the same language, as you know, which is it's really lifestyle, for sure, much more than supplements. And I think you probably do it better than me practically. I tell patients, and anyone that's my patient knows that what I say often is do what I tell you to do, not exactly what I do, because I'm not perfect. But, we all are working on this. And again, I think that the key thing is lifestyle at this time. So stress management, sleep, healthy diet, not too much alcohol, maintaining a routine, connections with friends and family, and exercise. So, all right. Can you talk about ibuprofen versus Tylenol and COVID? You want to grab that? I'm happy to talk to a little bit.
Yeah, I think the message that I've tried to give most of my patients is that at this point in time, there really isn't enough evidence to really make a recommendation against the use of those medications. And so my message to patients has been, if you've been using one of those medications for management of some sort of chronic pain-related issue, let's say osteoarthritis, I certainly have not advised patients stop that. I think the data would suggest that it's fine to continue those. Lisa, do you have any other?
So anecdotally, and in a couple of my other Facebook Lives, we've talked about this, there's small studies that potentially suggest that the anti-inflammatories, the ibuprofen and naproxen, may have an impact at a receptor that allows the virus to be more significant or more severe in terms of the infection. Now, again, I agree 100% the data is not robust. What I have said is, in the absence of having a chronic condition, if you're taking Tylenol, or you have a choice of taking Tylenol or Advil for a headache or for a low-grade fever, because we just don't know the data, my bias would be to tell you to take Tylenol, just because we don't know, and it's an easy substitute to make. But again, for someone who's needing to take them, it's kind of like the blood pressure medicine discussion as well. If you need to be on them for a specific medical condition and you need them, I don't think there's data enough to support stopping them. But again, in the setting of a fever, if you have COVID, I would tell you, I think there's, again, just trying to do anything that we can at this point, that I probably would use Tylenol only.
Mm-hmm. Yeah.
Right. I still hang out on my cul-de-sac with my neighbors if we stay 6 feet apart. So I've been talking about this in the last couple sessions as well. And certainly that is the approach that I have taken. We had 2 of our friends come over for pizza last weekend and sat outside really 6 feet apart and thought that was okay. I will tell you that the guidelines right this minute, and Dr. Birkholz and I were talking about this before we jumped on, which is just in the last really 24 to 48 hours, the discussion has become more intense and robust surrounding whether or not the CDC is going to come out with guidelines for all of us to be wearing masks when we're in public places. And these can be cloth masks or bandanas or scarves. And the rationale for that is, again, to protect others from being exposed if you are transmitting virus, right? So we definitely know that there's asymptomatic viral transmission. And so it's about protecting others. One of the things that's come up in the media right now, though, is the 6 feet rule really relates to our understanding that the majority of transmission of the virus is through coughing, sneezing, and droplet particles. Mm-hmm. And so that's really the 6 feet, because by gravity, those will fall to the ground and you won't be exposed to them if you stay 6 feet apart. There's a little bit of data, and what some of the concerns are now is that there is a little bit of aerosolization of the viral particles just with breathing. And in fact, the case that's really, I think, most significant to think about is the choir practice on the West Coast, where really nobody was sick and nobody was coughing. They were obviously singing, so expelling a lot of air, but where 60 of them, or 48 of 60 of them, are infected and 2 people have died already. And so I think the concern is that we may be, without coughing or sneezing, also aerosolizing particles. And so this is a long answer to say that I think at this point, the CDC is going to come out with guidelines for all of us to be wearing a mask. And so now, if you're thinking about hanging out with your neighbors on your cul-de-sac, I would say it's probably going to be 6 feet apart, and you probably should be wearing facial covering now. And I think that mandate, truthfully, is going to come out in the next 24 to 48 hours from our government CDC as being standard of care. So keep watching for that. You have anything to add, Laurie?
No, I think that's the main points.
My husband was confirmed positive. He's no longer having symptoms. How long should he stay in quarantine? What about me? I've been treating him but have not had any symptoms. So you want to take this, or you want me to?
Why don't you jump in?
Sure.
Go ahead.
So there's some interesting things that have actually just come out that I was looking at this morning. So in individuals who have asymptomatic infections, and we do think, again, we don't have lots of population surveys yet on this yet because we don't have adequate testing, but it looks like potentially 25 or 30% of people who get infected are completely asymptomatic. And what it looks like is if you have an asymptomatic infection, you actually don't shed virus nearly as long. What many of you may have heard on previous Facebooks that I've talked about is the data that's come out of China looking at the hospitalized patients in the ICU on ventilators. They actually were showing and I talked about it just last week, that they could detect viral particles in secretions and in feces for upwards of 30 days. Now, these were in the most critically ill patients on ventilators where many of them died. It now looks like that if you have an asymptomatic viral infection, your viral shedding period is very short. If you are someone who's had mild infection, your viral shedding period is a little bit longer. And those people who are critically ill in the ICU appear to have viral shedding for much, much longer. So a long answer, and there's no perfect science yet, so these are ranges, that it looks like if you have an asymptomatic asymptomatic infection, you're probably around the 12 to 14 day shedding. If you have mild to moderate illness, it's around that 14 to 21 day. And if you're critically ill, you're probably infectious for longer than a month. And so in those circumstances, and again, this data will become more firm and more clear. So this is just, again, kind of where we are right this minute as guidelines, and it's not perfect science. But if your husband was confirmed positive and had a mild infection, you would assume that he was shedding virus for several days before he had symptoms. And then I would tell you, in a perfect world, I would say 14 to 21 days after his first day of symptoms, he could still be infectious. And that would be the time frame that I would recommend that he be quarantined. And again, if he needs to go out for any reason, and frankly, if you're living in a household with children, my advice would be, again, aggressive hand washing, try to even isolate within your home, and that he should be wearing a mask, again, for probably those 14 to 21 days. The good news for you is if you've been treating him and have not had symptoms, hopefully that means that you've been exposed. You probably have had an asymptomatic infection and you're going to be fine. But without having the antibody testing that is coming, we can't actually confirm that yet, but that's coming, and that will be very helpful information when that's available.
Yeah, I think in this situation, you can't be too safe.
Correct. I think that's a great message, right? Masks aren't the answer, and let's all be longer rather than shorter in terms of our self-quarantining.
Yeah. Lisa, I want to come back just for a second. I did see a question come across about masks, specifically saying, should I buy a mask? Should I go out and buy a mask? And so I just want to make sure that we make the point that even with these suggestions and probably soon to be recommendations that everybody wear a mask, I think we still need to be very sensitive to the lack of protective equipment for our healthcare providers. And so I think we still need to think about who really needs them, and then who, would be great if they had them. And so I've seen, this amazing response on social media. I had a neighbor who reached out to me to say, hey, I'm making masks. Do you know where I can donate these masks? I think this is the perfect setting, this concept of maybe we all are now going to be wearing masks. This is the place for those homemade masks, the bandanas, the scarves, etc., in really those more medically appropriate, so what we refer to as the N95, etc., those really we should be reserving for healthcare workers.
Can't you just see it now? This is a new business. We're going to see Nordstrom and Saks and Macy's and all of the designers coming out with designer masks for all of us, right?
Indeed.
Bedazzled and jewels, right? Well, we'll wait and see here now. I predict that is a new business venture. Can my dog get coronavirus? The answer is no. Dogs cannot get it. I have heard that they can have virus that stays on their fur for some period of time, but they cannot get it as an infection itself. So they are not a source of transmitting it to humans. Mm-hmm. What's the latest on how this affects kids and babies? You want to take that, Laurie?
Yeah, I mean, I haven't seen a lot of change in this area. It still appears that the virus primarily is affecting adults. Now, that doesn't mean children aren't affected. What we think is that they're just less likely to show symptoms. And I think, again, that brings us back to, and I was just discussing with Lisa, I know yesterday our state's governor made the announcement that we are not going back to school for this 2019-2020 year. And a lot of that I do believe is, again, not having more than a small amount of people together, but also this question of, do we have kids that are asymptomatic and really transmitting virus unknowingly? And again, although most children are not going to get very sick, there are some case reports of both infants and children becoming critically ill. So I wouldn't say that there's no risk. I just think it's significantly less than the risk for most adults.
Right. In the state of Ohio, there's been one infant so far. In Cincinnati, at our Cincinnati Children's Hospital, there are Cincinnati Children's Hospital employees that are positive, but no cases in the hospital yet of kids here in Cincinnati. But I agree 100% with what you're saying. How much should I be sanitizing at my house, the car, etc.? You want to take that?
Well, I'll jump in with my 2 cents. So somebody sent me a forwarded, I'll say, Facebook post that had all sorts of ludicrous things, one of which was we should be washing our hands every 20 minutes when at home and wiping down everything on, a similar schedule. And what I've tried to tell people is, if you're not exposing yourself to anything coming in from the outside, such as groceries or a package from Amazon, it's probably not necessary to be sanitizing to quite that extent. Now, I think if there's been a potential exposure, that's when it really is important. So, we had groceries delivered yesterday from Shipt. And I brought the groceries in, I put the groceries away, and then we wiped down all of the surfaces. We made, special attention to washing our hands. But I think that, unfortunately, some people have really taken this maybe beyond what's necessary. And so trying to find that happy medium of what's really protecting you and those around you, but not driving you crazy.
Right. And I agree 100%. I was similarly sent a really interesting video about how to perfectly protect yourself when you bring groceries in from outside. And it was a video about if you have, glitter all over your and all over your bag, how do you get the glitter off your groceries and your bag and off your kitchen counters and your hands and away from you safely so that it's 100%. And I think the steps for the vast majority of people are overkill and unnecessary. Now, I say that with a caveat, which is, those people who are clearly immune compromised, the very elderly with multiple medical problems, and again, we have seen 50-year-olds who have died and younger people who have died. So this is not 100% reality. But I think, again, the older, sicker that you are, the more immune compromised, the more aggressive I would tell you to be, and careful with all of those kind of sanitizing approaches. Because again, we see that, right? So if you're a recipient, you have a donated organ, you're a liver transplant patient or a kidney transplant patient, or you have severe lupus and are on chronic high-dose steroids or ulcerative colitis, those are conditions then again where I would be much more fastidious. I think if you're otherwise healthy, again, hand washing and exactly what you said, but I don't know that you need to definitely do much more than that. And it really is hand washing. I'm absolutely in a position where I need childcare. My parents or in-laws can't help. What do you suggest I do to keep my family safe with a babysitter coming in?
That's a tricky one. I don't know that do you have a really good?
I don't. This is hard. And this is similar to, would you let adult children who are working remotely and would like to come back and work remotely from Cincinnati when they've been living somewhere else? It's the same thing in the concept of, what is social distancing and how are you trying to limit your exposure, right? So if that babysitter is one individual that you're letting in your house, and when that babysitter is not at your house, has a very limited network, and you don't have anyone that's at very high risk and you have no other choice, I would tell you, you have no other choice, and we're doing the best you can. Again, we were talking about this too, where if you have an elderly family member who needs help, how do you not go in and help that person, even though you know that you entering there is not completely social distancing? I think we have to continue to live and do the best we can. Social distancing is never going to be 100%, but we need to make it, the best as possible. Do you have anything else to add to that?
Yeah, no, at the very onset of this, before the shelter-in-place order was instituted, we had an arrangement with a former child care provider who was going to help us out. And we sort of set the ground rules, which were, this is where we're coming and going, this is where you're coming and going. Now, we made the decision that for us, that we didn't have to do that. That was more just a benefit to allow us to get some more work done during the day. But we pulled back on that even and just said, hey, we're going to do everything we can. But I think you're right. As is always the case, you just need to do the best you can.
My husband and I are spending a lot of time together and are starting to get irritated with one another. Help, what can we do to avoid killing each other? So you had a cute post, Laurie. I'll let you do that one.
Yeah. So like I said in my post, I think there's just been a lot of recognition that this is challenging for all of us to have our children home and try to go about our daily activities. But I've seen far less recognition of the difficulties this can impose on a relationship, be it a spouse or a partner with whom you live. And so I think, communication. We really need to understand the expectations of our spouse, our own expectations. And in order to do that, we have to communicate with one another. And this is something I'm learning day by day, sort of the recognition that I'm not the only one that's stressed and challenged by this. And so to sit down and have a daily check-in, for us, it works best for us to do that in the morning. And then I think, again, at the end of the day, sort of, what are our goals for the day? That concept of we're going to divide and conquer. So who's taking the breakfast and the morning routine, who's going to do lunch, who's in charge of dinner. And then at the end of the day, sort of, what worked and what didn't. And it's okay to say that it was a really crummy day. But here's what we're going to do differently tomorrow. So at the end of the day, it doesn't matter how or when you communicate, but just that you simply are. I think the other piece, and again, these are really tips that we probably should be employing all of the time, not just during a pandemic, but, acts of gratitude in really making sure that we are not taking one another for granted. So, the ability to say thank you for the simple things like, hey, thanks for getting the kids up. Yesterday was, for me, a really incredibly stressful, long day. And although I was tempted to open up the bottle of wine, I made the decision instead to just get out of my house and go for a run. But in order to do that, my husband had to then take on the bedtime routine for the kids. And I made a point when I got back to just say, hey, you know what? Thank you. Thank you for giving me the space to do what I needed to do to take care of myself. And I think, again, that just goes a long way to showing gratitude for your partner. And then I think there's the need for a sense of humor. I read a post that a couple had come up with the idea of creating a make-believe work partner in the house that they would sort of pin all of the things on. So, right, rather than saying, hey, Eric, why did you, leave this out on the counter? It was, Eric, did you see Carol left the, milk on the counter again? And just a way to sort of loosen it up and allow that communication, but in a really less confrontational way, shall we say.
Well, those are great tips. And as most people who know me, being very flexible is not always what I am. So this change in where I'm working from and how I'm working and my schedule has definitely been challenging for me too. So your points are all very apropos and I hear them very well. And, in my situation, we're working on that too. It's a different time for all of us right now.
Absolutely.
What underlying conditions make people more susceptible to severe infection? Heart disease, diabetes, asthma. What about autoimmune diseases and allergies?
Yeah. I mean, my understanding, Lisa, really is that, those first three are the biggies, right? So heart disease, diabetes, asthma. I don't have the reference in front of me, but I just read a study, a larger study. I want to say it was around 7,000 people, U.S. patients, in really the vast majority. I think it was something like close to 80% of patients with severe illness had number one, diabetes, then heart disease, and then chronic pulmonary or lung diseases. So those really are the biggies. I think, and correct me if I'm wrong, but the issue with individuals who have autoimmune disease is many times those patients are on medications that suppress their immune system. In doing so, make it much more challenging for those individuals to fight off an illness. Do you have anything to add?
No, I 100% agree with you. I mean, in talking with patients and just the general community, I mean, again, we don't have tons of hard data about some of the other conditions. And I guess just the party line is, if you have any health conditions, you should be more careful. If you're older and you have health conditions, even more careful. Just we all should be careful and again, presume that it might increase your risk of more severe infection a little bit and take as many precautions as you can. Do you think social distancing is working? Is it going to be as bad as Italy is here? Well, so I keep talking about the numbers and I will tell you that New York is as bad as Italy. New York is in dire straits. And it's a bad situation. I think what we are lucky to have is the ability to bring resources from other areas to New York. Italy, the country itself, was and remains overwhelmed. The social distancing is definitely working, no question. Anyone that's listened to me, I say great things about Governor DeWine because he implemented our stay-at-home policy early when we had very few cases here, when there was a lot of pushback from everyone to say, oh my gosh, the flu kills more people. Like, why don't we do this? Why are we doing this now? We don't do this for the flu. And it's because Governor DeWine listened to the powers that be, healthcare workers and people in, from the World Health Organization and from public health thought leaders and Dr. Fauci to say this is really coming and we need to do the social distancing. And our numbers in Ohio have continued to go up, but not at the exponential rate that we certainly have been seeing in New York. And I think we anticipate that we will have enough hospital beds and hopefully enough resources in Ohio. I don't know, Laurie, about you specifically with your numbers, but New York is terrible and we are not out of the woods. And New York is Italy repeated. So that's why the social distancing needs to continue for much longer than we all would like. And I support the extension of all of these stay-at-home policies. And again, what Michigan did for ending school really makes sense.
Yeah, absolutely. I think, just to piggyback on what you said, the benefit we have here in the Midwest, and certainly in my community being a more rural, less populated area, is that, we can follow the guidance that is being obtained by looking at places like New York City. And so we have a little bit more time to put in place some of the measures. So although, if we were to do nothing, there's absolutely no way Michigan would be prepared. We have about 25,000 hospital beds, and of which, only a small percentage really are those beds meant for really severely ill patients. But again, our governor has been really amazing and has put in place some really important steps so that, again, with time, we have the ability to reallocate beds. So beds that were previously not intended for severely ill patients, right, are being diverted to have that space. cancellation of elective surgeries, right? All of those things we've had time to put in place, which will hopefully be really advantageous and prevent situations like what we've seen in Italy and are seeing in New York.
Is there harm in putting off a dental appointment 3 to 4 months? What about an annual gyn exam, mammogram? How long is too long to put those things off? What do you think, Laurie?
Yeah, I mean, I think those routine, in an otherwise healthy individual, a routine dental appointment, a routine annual gynecologic exam, if you're not having any specific symptoms, I think certainly waiting 3, 4, maybe even 6 months is probably just fine. And I think for those things that require attention, be it a refill of a medication or something of that sort, thankfully we now have the ability to do telemedicine in a way that we previously did not. So a lot of the regulations and restrictions around telemedicine have been relaxed for COVID right now. And so I know where we were in my practice that I just finished up, and my intention certainly is moving forward to really do as much of the non-face-to-face type of care as possible via telemedicine routes. I think you guys you've had that capacity for a while, Lisa, and so I'm sure you've been taking full advantage of that.
Yeah, right. I would tell you, just funny, I'm going to worry more about my haircut for 6 months than I am the dental appointment, but I 100% agree. I think right now, again, we don't think this will be 6 months before you can get your mammogram, but I do think right now you should wait. We have not hit the peak. Exposing yourself in a healthcare facility when you don't have to is not the right thing, and I would push that off. My parents.
I would say though, and I had a couple of these calls a couple of weeks ago. If you feel a lump, if you notice a change in your breast, absolutely you need to contact your provider, and that is certainly an instance that may require a face-to-face visit and an imaging study. So certainly if you are symptomatic, do not.
That's a great point. We are talking about routine asymptomatic screening tests, which is very different from anyone that's having symptoms or problems. We do still need to take care of all of the things that we would routinely do for people not in a COVID situation. My parents are in high-risk categories, but staying quarantined plus visits to the pharmacy drive-through. When can I feel it's safe for them to meet my newborn?
I think this comes back to, you just can't be safe enough. And with the technology we have available for video conferencing, my opinion would be that really it needs to wait, and we need to be creative about how we connect with our loved ones in all of these scenarios, even if it's a joyous occasion like a new family member.
Right. I 100% agree. There definitely are stories out there. And in China, they did the quarantining differently, which is if there was a person who was positive or sick, they were removed from their household. Mm-hmm. What we know in the States is people who are quarantined or self-quarantining at home. And we definitely have seen, multiple family members in a household infected, and, there's been deaths related to that. So again, in the setting of elderly parents who are high risk and a newborn baby, I would tell you right now, I wouldn't take any chances with that at all. Mm-hmm. And I would just wait. As hard as that is, and there are so many things that are so hard for people right now, so many things that have been canceled, so many happy celebrations. My daughter's medical school graduation, my daughter's wedding, things that are really important milestones like the birth of a new baby. But again, right now we are all in this together. We all have to do this, and I would protect that baby and protect your parents and stay put till this is over. So that's my song and dance with that. All right. Anything else right now? You got anything else on your side, Laurie?
Yeah, I'm just quick scrolling through. Yeah, I think we've maybe covered them all. Yeah.
All right, everybody. You have any last things you want to say, Laurie, about your practice or anything? Timing?
Again, Yeah, so I would just encourage people who are listening, if you're interested in learning more about the practice, really head over to my website. Pretty straightforward. It's lauriebirkholzmd.com, and sign up on the contact form. As I mentioned, things are changing every day, and I'm really trying to take advantage of the opportunity to get my practice up and running as quickly as possible, so that I'm going to be available and able to be there for my patients through this difficult time.
Great. And we will be doing more Facebook Live from the Ms.Medicine site. So anyone that's listening, I encourage you to sign up for our Ms.Medicine newsletter, or sign up, follow Ms.Medicine social media channels. And our website is Ms.Medicine.com. And we will be back probably next week sometime. So thank you to everybody for participating.
So fun. Bye, everybody.